Hello everyone, welcome to the pharmacy portal. On the pharmacy portal of Avalon Health, you are going to get welcomed on this dashboard. On the dashboard, the pharmacist is going to say total number of prescriptions, issued prescriptions, quotations. In this case, we have four created quotations, completion rates, quotation to invoice to receipt, ratio. Down below, you are going to see monthly prescription activity on this bar graph. Today's prescription activity. In this case, we've got no data for the day. The doctor can also check quotation statistics by clicking on this document analytics button, and where they are going to say total quotation created, invoice statistics, total invoices generated, receipt statistics, total receipt issued. Let's move on to the billing dashboard. So on the billing dashboard, the pharmacist can manage prescription financial information and invoices. They can see the credit balance, prescription status, payment completion, receipts pending, the total prescription value. In this case, we have 346.15 prescription total prescription value. Going down, the pharmacist can also see an overview of the receipts and pending invoices, or they can check receipts only or pending invoices only by just clicking on these buttons. In this case, we have no pending prescription payments which are found on a system. Let's go to the overview. On the overview, the pharmacist can see total prescription invoices, prescription receipts, pending payments. In this case, we have no pending or outstanding prescriptions. We have free prescription with receipts, total prescription invoices. We have free with a total amount of 346.15 total invoice value. They can also see total prescription quotations, total financial summary, and let's move on to the search patient. On the patient section, the pharmacist can either use first name and last name to search for a patient or an Avalon ID, or they can use a phone number for the organization. In this case, I'm going to use an Avalon ID. For those who don't know what an Avalon ID is, so an Avalon ID is generated on the doctor's portal. When a doctor adds a new patient, that patient gets an Avalon ID. So it's like an identity that is given for the patient which are added to Avalon Health. I hope you are following. So I've searched for a patient, and this is the patient I've searched up for with Avalon ID 13. So the pharmacist can open the file to view the files which were created on the doctor's portal. In this case, Mr. Wisdom Balicholo, this is his information. You can also check the documents. They are not documents, unfortunately. Let's move on to search prescriptions. So, for the pharmacy to search for prescriptions which were created by the doctor, they have to fill in a prescription identifier. So let me show you where the pharmacist can get a prescription identifier. So when the doctor writes a prescription for a particular patient, a prescription identifier is also generated. On the prescription orders section, there's a summary of total prescriptions, the active ones completed, inactive, and notifications sent. So here is a prescription identifier. Is an example. These are examples of prescription identifiers. So let me copy this prescription identifier and I paste it on prescription. Search prescription. So as you can see, here is a prescription with the prescription identifier that I've just filled in. The patient, the date, status, it's active, prescription items. So it's amoxicillin, dosage 500 milligrams, capsule, quantity is 23, instructions 2 per day. So for the let's say the pharmacist want to search for a new prescription. They can click on this new search, and they will get redirected to this section that we were on. Let's move on to quotations. On the quotation section, the pharmacist is going to say the quotations which were created for different patients, same as the statuses of the quotations, the accepted and the rejected quotations. You can click on this open quotation to view a certain quotation. As you can see, here is another quotation for Mr. Wisdom, provider Mr. Panache. They can print for storage purposes or record keeping. Let's move on to invoices. Alright, before we go to invoices, there's something which I need to check real quick. Oh, that's right. Okay. So they can see the status, issue date, expiry date, currency, the amount, the subtotal, and the total as well. You can also check the statistics by clicking on this button, where they are going to see a bar graph, a pie chart showing the statistics of the page, the outstanding amount if there is any, the collection rates, the total amount, and so on and so forth. Let's go back. Let's move on to invoices. On the invoices section, the pharmacist can manage and track all your patient prescriptions invoices. So as you can see, we have 3 total prescription invoices, the 3 paid, 0 unpaid, and 0 partial paid. So the pharmacist can click on the view receipt if you want to view the receipt or download it. In this case, the receipt might have been deleted. It's not showing. Let's go back. You can open an invoice. So as you can see, this is an invoice which was recorded or created. You can also print it to save it in their devices for record keeping or for printing purposes. Let's move on to receipts. Okay, on this section, the pharmacist can see the statistics of receipts, total amount, latest receipts. So this is the total receipt number of a receipt, recent activity, the payment method as well. Mobile money, we have 1 which was paid using mobile money, and 2 which were paid using cash. They can check all the receipts. These are the receipt numbers, the patient, provider, payment method, amount, and payment due. So they can click on this action button to view receipts or view the invoice. Let me view the receipt. Okay, so here's the receipt. They can also view related documents like prescription invoice or prescriptions. Let me view the prescription. So here's a prescription. They can also print it, create a quotation, or mark prescription if they want to mark it. Okay, view receipt. Alright, so these are another receipts, prescription. Okay. Alright, so this requested invoice could not be found, or maybe might have been deleted. So I think this one was deleted. That's why it's not showing. Let's try to view this prescription right here. This one is available. So it's also the same as alright. So it's also showing the patient information, the prescription validity, refuse if if there are any refuse allowed, repeats allowed, medication items, provider. So there are no medication written or information written on this. Alright, let's move back. Alright, let's try to search, see this one. Alright, let's fill. Because I want to show you how you can how you can create a quotation. Alright, these prescriptions were not filled out. So okay, I can't create a quotation. Let me search for a working one. Prescription orders. Alright. Okay, so let me open this one. Alright, it's loading. Great. So this is what I'm talking about. Now this one is a complete prescription which was created for patient Mr. John Doe. You can see the date of birth, the medication, the quantity, medication 2, and the provider signature. And you can also see the name of the provider as well as the date it was created, instructions, dosage, and so on. So this is a proper medication prescription. So you can also see the prescription validity, valid until no repeat, no refuse, and so on and so forth. So this is where the pharmacist can create a quotation. You can also mark this prescription if they want to mark it as dispensed or cancelled, dispensed as incompleted. Alright. Substitution made. If there are any substitutions which were made, you can actually click on it and then fill in the substituted medication. Notes, add notes. So this is optional as well. You can either write anything or just leave it blank. Metformin. Okay, metformin, 100 milligrams, quantity to dispense 60. Substitution made. So okay, after filling up this, that's when the pharmacy can actually dispense prescription by clicking on this dispense button. Let's say right. So the prescription dispensed successfully. Right. So it has been dispensed completed. Yeah, if I can put it that way. Open. Let me open this one. Alright, seems I can't create a quotation for this prescription. Okay, let me search for one which I can actually create a quotation so that I show you how the pharmacist can create a quotation for a particular prescription. Let's try this one. Yeah, right. I can create a quotation for this prescription. So the pharmacist can select the currency. We've got quite a lot of options the pharmacy can pick from. Right, okay, sorry, let's go back. Right, the expiry date. So let me write anything. Quotation created for tasting purposes. Alright. Terms payment due within 30 days of issue. Amoxicillin unit price. Let me just write $10 right here. Okay. This is gonna take a while. but let me just write in, fill it in the quickest way. All right, $10 like this. Right. So as you can see, it automatically calculates like the total amount from the quantity, unit price, and so on and so forth. So the pharmacist can also select availability if the product or the item is in stock, out of stock, or alternatively available. So in this case, let's start selecting stock. Value added tax is 15%. So here's the total amount. Oh, okay, no, here is the total amount right here. And after filling up this quotation, the pharmacist can then create quotation. So this quotation is going to get sent to the patient. It's going to get sent on an email, and alright, I don't know what happened here. Can I read properties of alright, let me check. Oh, I think I might have received something on my phone. Let me see. Yep, that's right. I've received the quotation on my email. So I've registered myself as a patient. So the patient is can also receive these quotations after they've been created from the pharmacy, so that they can approve or reject a certain quotation. So I can see the amount and also the information about the quotation. Ah, okay. So this quotation, they actually come to my patient portal, which I'm going to show you in another video. All right, so I've shown you how to create a quotation, right, on the pharmacy portal. Let's move on to invoices. So on this section, the pharmacist can view, open invoices, and can also check the receipt. See the status says at the page. Um, you can also see the total, the amount. You can click on this open receipt invoice button to view an invoice. They can print it by clicking on this print button. All right. Let's move on to prescription orders. So these are the prescription which were written or which were created by the doctor on the clinic portal. I'm sure I've shown you this section, right? So let's move on to users, right? On this section, um, the pharmacist can add a new provider. Let's say they have other providers they are working with. They can link to another user optional if this provider is an assistant, link to doctor. All right, select type, I'll say assistant. Profession, I'll just say assistant as well. Prefix, Mr. First name, let me just write all right, gender, male, date of birth. All right, so I'm just putting in some daily data. This is not my actual information. Trauma surgeon, select type of identification, 12. All right, select purpose, appointment, email address. So I'm just writing, this is not even okay. Let me just write anything right there. Okay, let me just write zeros like that. It's not my actual number. Failed to aid provider. Okay, let's try again. All right, I'm going to try again and show you how it's done. So in this case, we have only one provider which has been added, and you can see the delivery, organizational day, roles and permissions which are assigned. So you can assign a role like this, and then you click on add role. Provider does not exist. Okay, so they can edit or delete. So this is how where the organization provider ID comes in, the profession like I had shown you, the prefix, the username, first name, last name, national ID, passport number, gender, date of birth, phone number, email address, profile image. If you want to edit profile image, so you can put the URL and select the country. After you're done, that's when you edit. Okay, let me just write something there. So this is just a dummy data. Alright, so the okay username already exists. Alright, it's fine. So that's how a pharmacist can aid a provider. Thank you for watching. In the next video, I'll be showing you how to navigate through the patient portal.